Factor Uncensored. As we told you, AI is taking over. Not like Skynet just yet, but there's AI for your pet's health, and now there's AI for your health. And we talked to a technology company that they are making it easier for you to determine the illnesses and the diseases that you could have in the future. Take a look. And now, Severance, we have a problem. I'm one of those people who do not want to know what's wrong with me medically. My sister is the total opposite. She goes to the hospital and to the doctor for every damn thing that happens to her. But your technology could help individuals even predict what could happen to them health-wise. Tell us a little bit about the medical AI that you have and that will soon be available or may be already available to the public.
Well, Isiah, thank you very much for having me on. And actually, our technology will be available in the Houston area, I believe in early January in dialysis clinics. So we're very excited about that.
Now, why dialysis clinics?
That's our customer, Innovative Renal Care. They purchased the kidney module. And so our customers are both health insurance companies, but also doctors and hospital systems. And our flagship product, Medical AI, basically what we are able to do, Isiah, is we're able to predict in the future, are you going to get better or worse? Are you going to have a heart attack? Are you going to the hospital? And, you know, I'm kind of like you, Isiah. I don't want to know like my entire fate out there, but I do want to know like, hey, if I'm going to have a heart attack, right? And our accuracy is 89% predicting a heart attack in 6 weeks.
Wow.
Yeah, we're blessed. You know, it's a lot of hard work and science went into it, but that's one part, Isiah, right? Now you know if someone's going to get worse or better, what do you do with that information? And that's the real secret sauce. It's called next best actions. Mm-hmm. So we're able to tell the physician or the nurse or the family what is the next best action to do to prevent that adverse effect, such as hospitalization or heart attack. It could be something as adjusting the heart medication. It could be a baby aspirin, or it's like, hey, we got to get him to the cardiologist, right, for a stress test immediately. So by being able to do that next best action, we're able to provide interventions in someone's health that can extend their lives. Now, we talked about kidney care and dialysis earlier, but if we move up the stream, what's called chronic kidney disease, if we catch people in the right period of time in stage 2, we can keep them there for 5 to 20 years. That's a life extension, right?
Yes, it is.
I mean, so I look at it as more hugs, right, for a grandmother to their grandkids, or more life experiences that we're providing our clients. So yeah, that's a summary.
And usually there's some pushback from doctors because this could almost replace them, not replace them, but as far as providing the information. But it seems like the medical community is embracing this with the contracts that you're getting and coming to Houston.
Yeah, I would agree with that, Isiah. You know, we were worried too, right? We were in 3.5 years of pure research and development, and we released it. We're like, what is the medical community going to say, right? You're always going to have naysayers about new technology. And what we found out is that we were actually at a number of conferences over the last 2 years, and we'd say that 90% of the people that came up to our booth and talked to us were positive. Now they're coming to our booth, right? So, you know, it's probably skewed, but the younger doctors have been saying, we've been waiting for something like this, right? The younger individuals are more tech adaptive, if you will, and they want to be able to be aided. Now, then you have the argument that, oh, we're replacing the doctors, and we're not replacing them, Isiah. We're helping them, give them more information at one time to do a better job. So the example I give my mom is, Mom, if you're flying from Boston to Houston on a plane, do you want to be on the plane with just the pilot, just the computer, or both? I know I want to be on the one that has both, so there's a fail-safe, if that makes sense.
Good point. Excellent point there. Now, for those who are interested in having themselves diagnosed by this AI, is it only through one of your partners through the hospital system, or can an individual find his or her way to it and see what their diagnosis would be?
Yeah, so we don't use the word diagnose. we are a tool for doctors to use for better care, right? We're very careful about that word. And number two is it is only through our customers, right? So that there is a doctor, right? So our job is not to do that. It's the doctor's job to use the information that our AI tool gives them and make the final decision.